you take ownership, no, of the exam that you're taking. No, it's nobody else's responsibility but your own. Okay, so these are the things that we're going to be talking about for this part. When do you prepare for your exam? What do you prepare for your exam? And who can help you prepare for your exam? Okay, now is this studying or preparing? Is there a difference? Now you have to know. Now, what is your goal or your motivation? Why are you doing this? Well, what is this for? It could be for many things. No, um, you're trying to graduate, trying to pass your licensure exam. Could be for many things. Okay, is it to pass the exam? Is it to ace the exam? You want to know, or maybe it's also for evaluating yourself. Okay. Now, when do you prepare for your exam? When? How much time do you have? It's also an important question. No? The question also is how much time do you really have? You have to be realistic. Okay? No? So when you prepare, you prepare for it now. Okay? You should have been preparing from a long time ago. From when you were taking your undergrad courses, you should have already been preparing for your exams. Now, of course, we can't take back time. So if you weren't exerting as much effort as you should have, then now's the time to really catch up. Okay, so you have to be realistic. How much time do I have? Okay, so of course there are other distractions. No, for some of you, you have distractions such as playing games, partying, going, attending social events. No, some of you, you might decide to work. No, I've encountered a lot of those who are preparing for their licensure exams, but instead of just focusing on preparing, they're actually working. They're because they feel bad about not contributing to their families in their general family's income, that they're draining from their family's resources, no, stuff like that. But actually, in the long run, no, um, if you keep thinking that way and you distract yourself from your actual preparation for the licensure exam, you're actually taking a big risk of not passing. Okay, and what will happen is that you're going to be becoming even more of a burden as you think of yourself at this point already. Okay, now so don't think of yourselves as a burden to your family or even as somebody who is not contributing. Okay, now for a lot of students that we have, or those who are preparing for licensure exams, a lot of you have been delayed in graduation. No, you know that you spent a lot in your studies, so you can have that feeling or sense of guilt, no, and decide to work. But then you have to really think of your long-term goal and the long-term benefit of passing the licensure exam. So don't get yourself distracted. Okay, so really the question is, it worth the risk of failing? Okay, so definitely you have to give yourself time. You need to focus. No, you should not get distracted. Whether it's a good thing or a bad thing, you think I want to feel good about not being such a burden to my family or being helpful. But at this point in time, no, you really need to give yourself time. Ayan. Oops, sorry. Ayan. Okay. So there are a lot of materials actually, no, that you can use for your review. No, you want to organize them. No, so of course you have your own notes, you have your textbooks, you have different compilations. Nowadays you have online resources, no, that you can use as well. But you have to be careful. No, you have to be careful because some of them, no, you can well having so much review material can also be a burden for you. No, you don't know where to start. You don't know which ones to use. No, I've encountered people who spent a lot of time just printing out review materials and actually not being able to read them. No, so give yourself enough time, no, to make or download flowcharts, diagrams that you will actually study. Okay, so yeah, there are so many resources out there. You also have your ebooks. No, please remember, no, that usually, no, for the different boards of specialization, no, they will be using the official textbooks. Okay, so for example, for Endo, no, Pathways of the Pulp, no, is still the definitive textbook. Okay, so you might have a copy of Grossman's, which is fine. I use Grossman and Pathways of the Pulp, Cohen's, for my lectures. But Cohen's is still, the definitive textbook. Okay, so and especially for this group of members of the Board of Dentistry, we actually have two endodontists there from UP. No, the two new board examiners, no, are from UP, and they're both endodontists. So it puts a lot of pressure on us and on me, no. But at the same time, that they're definitely using Pathways of the Pulp, as well as, no, for their other references. They will use AAE, no, the releases of American Association of Endodontics. Now, of course, there's also the possibility that they might use old material. And after all, these board examiners, and I'm not just talking about Endo, these board examiners have question pools. No, they have exam questions that have come from decades and decades of licensure exams. So you might encounter, and you might actually come across some questions that seem outdated, and that's something that you could expect. No, so you really need to uh, be discerning. No, and later on when we discuss how to answer these multiple choice type of questions, no, you will get in more detail with for those things. But yeah, you of course definitely you prioritize the latest accepted concepts, the latest knowledge, no, that's accepted in the profession. But you need to be aware also, no, that these questions might come from elsewhere. But I am almost pretty sure that in terms of endo, these will be updated questions, no, because I one of them was actually my teacher. And she's very meticulous. She's known for being very meticulous and being very strict, at least to other people. No, so yeah, so uh, please make sure, no, that you prepare yourselves well, no, and you do all of these diagrams, no, and flow charts, so that it will be easier for you, no, to understand how things are, for example, how decisions are made, no, especially because um a lot of our questions now in the board exams are more clinical. No, they're not gonna ask the names of who discovered whatever, no, or when was this. No, no, a lot of them are clinical applications now. No, because we are in the age of problem based, no, and dentistry, and outcomes based education. No, so when you see outcomes based, the outcome is being able to treat your patients. Okay, so yeah, so OBE, no, is the track that CHED and PRC have been trying now for several years, and the questions are more getting more and more in that direction, as well, no, for the licensure exam. Okay, ayan. So yeah, you've learned how to, for example, do this Cornell note taking using mnemonics, use visual aids, flowcharts, tables, and diagrams. No, again, give yourself enough time for this. Okay, for some of you already have notes, no, but it's still different when you make your own notes. Okay, let me just go back. It's still different when you make your own notes. Okay, so when you read books, now when you read books, you can make your own notes as well. No, don't just rely on other people's notes, because when you're the ones reading, making the notes, the writing process itself no, will allow for more retention. Okay? I know a lot of you are borrowing notes or sharing notes, and that's fine, but really, no, the more senses, no, you involve in your review, the more retention you will have. Okay? Even of course there are different learning styles, so you have to know what works for you as well. I know you learned this in your pedagogy, no, the learning styles. So um trust yourself as to what your learning style is, no. So some people will prefer very quiet workspace, no. They want to study alone, and that's fine. Some people would want to have group study, and that's also fine, as long as you get to control how you use your time. Okay, some people want a combination. In my case, I like variety, so I can study by myself, and I also studied with a group, and that worked fine for me because I like the variety. I don't like just doing one style or using one style. And doing having group study sessions also helps you with your retention, because you know the way that your group mate ask questions will ask questions, so it might be different from the way that you think. Okay, because a lot of items that come out in licensure exams are those that are considered important to know. They are really need to know. It's just that sometimes the manner that these questions are asked might be different. Okay, the choices might be different, the terminology that's used for asking might be different. No? So the more exposure you have to the different variations, no, of how these questions can come out, no, will help you as well. Okay, and again, as I said, retention, no. So even the jokes that we made, no, to help us remember, no, so because we made jokes, and these became mnemonics, no. So um your learning style, no, will be you need to maximize, no, your preferred learning style. Okay, now I want to show you this one, no, because this one is, you know, from the internet. Okay, so you have a lot of these in the internet, and you have to there are different ways, no, of presenting the same thing. Okay, and different things can work for you. Now, for example, no, you can use these mnemonics. Okay, no, so and then yeah, this also, yeah. So make sure, you know, if you use the mnemonics, that you remember what they mean, what they actually mean, no, because uh while mnemonics, especially those that are a bit controversial, no, might distract you from the actual thing that you're memorizing. Okay, no, yeah. So for example, this one, oh, so these are information that are available on the internet, but take a look, no, down here there's actually an error. Okay, no, so you don't just rely, no, on what you see and not be discerning. Okay, yeah. So give yourself enough time to study as well. No, you want to check what you know and what you don't know. No, take a simulation exam before you review. Take previous exams to develop confidence and test taking skills multiple times, not just once. No, and really, I encourage you to participate in a study group. Okay, prioritize. You need to cover topics from all clusters. Don't take too long on a few. No, so even if because I know, no, a lot of you will be giving a lot of priority for cluster 1 and cluster 2. Okay, no, and these are of course very difficult, right? But you need to make sure that you cover everything, no, especially because for a lot of you, it might have been a long time since you um, studied these courses or took these courses, and if you did not really invest a lot of time when you were taking these courses, maybe, you know, you've forgotten most of them. Okay, start now. Don't procrastinate, and don't cram. It's really impossible for you to cram, no, for our licensure exam, no, because it's nine clusters in 3 days. Okay, it's not once a week. No, like unlike in other professions. No, so in other professions you have period, no, in between clusters or in between days of taking the licensure exam. No, so in our case, it's 3 consecutive days. Okay, so plan very well your study time. You should have a regular and structured schedule, but of course, it should be amendable as well. No, and then you train yourself. Train yourself to follow this schedule. Eat healthy, drink a lot of water. Okay, you need to make sure that you take care of your health as well. I know some of you are already showing signs of stress. Okay, no, so you need to make sure that you also take care of your body, no, your body, your mental health. I've known some people who were suffering from alopecia during their entire dental education up until the review, and once they passed the exam they gained their hair back. No, so yeah, stress really does a lot of things. No? It also will affect your performance. Okay, so you also need to sleep, get enough sleep and rest and recharge. Okay, don't push yourself so much that you're not going to be able to function. Okay, let me just get back to this. There was a time when we had this student who actually performed very well throughout her student life, you know, as an undergrad, and she also did very well during the TCAP exam. But when it came to the actual licensure exam, no, she had a fever on the first day. No, actually, during the first day of exam, she was already having fever. For I think that was the third day of her fever. No, just she was so stressed out. She was the pressure was on. No, and nothing they did no could bring down her fever. But she still took the exam, and of course, what happened was even though her average would have passed, no, well, we expected her to do well, but even though her average would have passed, their cluster one was so low that she failed that licensure exam. Okay, so you don't want this happening to you. Okay, no, so of course, again, there are so many temptations, but no, I'm not saying don't have fun. I'm not saying you shouldn't relax. Okay, but definitely, no, definitely you have to limit yourself. Now if you know that, you know in yourself that you cannot be controlled, then just don't. Okay, but if you know that you can have this discipline, then set a timer or alarm to limit yourself and how much you use social media, especially now. No, there are more and more means of getting distracted on social media. Okay, there are more and more apps and more sites, no, that will distract you. Okay, I'm done with, I know I'm done with FB. I'm now going to TikTok and all that, and then I'll go to threads and whatnot. No, it's never ending. Okay, no, so you have a better use for your phone and your gadgets, but you can use them for reviewing, right? Okay, now what do you prepare for your exam? Okay, now days prior to the exam until the day of the exam, eat right. No, you don't eat something that you have not tried before, and don't eat too much. Okay, this is not the time for food trips or food adventures or for your food blog or vlog. Okay, prepare for what you will be bringing and wearing ahead of time. The exam is not a time to flex, or nor is it a fashion show. Keep it simple and basic. Double check all your requirements or all the things that you need to do. Now this includes of course for your practical phase. Okay, and then yeah, prepare them, make sure that you have everything with you. Okay, okay, so make advanced arrangements to ensure that you will arrive in the test site or your, yeah, early every day. No, you want to acclimatize yourself to your surroundings and keep you from this will keep you from panicking. No, ang hirap pag tinas. When you transfer files to Drive, this happens. No, anyway, yeah. So familiarizing yourself, acclimatizing yourself will keep you from panicking. Consider transportation issues like the volume of traffic, rush hour, Consider renting a space near exam site. Scout the area ahead of time. It will make you if it will make you feel better. Make sure that you get adequate sleep within the last couple of days prior to the exam. No, use the toilet, of course, before the exam begins. That's that's very basic. Okay. Now, uh, there's really no point in cramming no up until the last minute. Of course, go ahead and read. No, fine. No, I cannot blame you if you will still be reading, but don't make yourself panic, and don't try to catch up on so many things right up until the end, because your sleep and being able to think clearly no will be important. Okay, so of course you have all of these requirements. Okay, okay. Now let's go to multiple choice exams. Wait, what happened here? Hmm, sorry. Ako lang nangangalay, pati pala ang slides ko nangangalay. Joke. Ayan. Okay. So, multiple choice type exams are actually deceptively difficult. Okay? So you might be thinking, okay, I can guess, diba? Because it's multiple choice. Okay? Oops. Ayan. So, why do they actually give multiple choice type exams? So, well-written multiple choice work well to measure factual knowledge, basic comprehension, and cognitive application. So, even your logical skills are being tested here. No, it's not just testing what you know and testing whether you've learned enough, but even your thought process is actually being tested. No, when you have your multiple choice type exams, and that's why you will see, modified options, in multiple choice type exams. Okay, and also, of course, a very big reason, no, is that they take less time to answer and less time to check. And this is a very good motivation for the Board of Dentistry to keep going and to keep giving multiple choice type exams. Okay, this is not the same as the board exams where they give essay. Actually, long ago, if you know Doc Tony, no, during their time, the licensure exam for dentistry was in essay form. Sabi niya, like, what? Anyway, it's just it's just um quite challenging to check, I think. But there were very few of them because now, no, I don't think that's possible. Okay. Now, students commonly consider multiple choice exams easier than essay exams. Okay, why? Because the current answer is guaranteed to be among the possible responses, right? So they're there among the choices. It's just hidden. Okay, so you can actually score points with a lucky guess. Okay, no, but do you really want to rely on luck? Okay, many multiple choice exams tend to emphasize basic definitions or simple comparisons rather than asking students to analyze new information or apply theories to new situations. Okay, that's why of our licensure exams are more outcomes based. Okay, because multiple choice exams usually contain many more questions than essay exams. Each question has a lower point value and thus offers less risk. So that's why you have 1 point per item in multiple choice. That's why students usually would think that multiple choice is better. Okay, now, why are they difficult? Multiple choice exams contain many questions. They force students to be familiar with a much broader range of material than essay exams do. Okay? And students cannot bluff on a multiple choice exam. You can't use flowery words. You can't write many sentences just to fill the paper. No? And now, and also, the topics that you need to study are more in a broader range because when, for example, you're talking about essay, there are very few questions that can be asked in essay form. But for multiple choice type questions, no, you can ask this in you can ask on any topic using multiple choice. Okay, yeah. Now, how do you prepare, for a multiple choice type exam? Of course, there is no good substitute or better substitute, than knowing the right answer. Okay, so knowing the right answer is still the best. Okay, now preparing for a multiple choice type exam, of course, involves beginning to study early. Okay, now multiple choice exams tend to focus on details. Now, you cannot retain many details effectively in short term memory. That's why you need to study early. Now, if you learn a little bit each day and allow plenty of time for repeated reviews, you will build a much more reliable long term memory. Okay, make sure that you identify and understand thoroughly everything that your instructors emphasized in your classes. Again, why is this important? Because the questions may be expressed or stated differently. Okay, if you are not be able to process the questions correctly. Okay, describe important events or features, or that tie related ideas and observations together. There are items that most commonly appear on multiple choice exams. So there are such items. So when we give our lectures, we often say that, oh, this comes out a lot. This is important. Okay. So as you study your notes and other reading materials, make lists and tables. Concentrate on understanding multi-step processes, the sequence of processes and ideas, events, or objects that form natural sequences or groupings. You group things together. Look for similarities. Look for differences that might be used to distinguish correct choices from distractors on an exam. Okay, so uh, things that are total opposite of each other are important to note. Okay, yeah. Brainstorm possible questions with several other reviewees. As I said, group study or group review is helpful. No, and practice on sample questions. Okay, so these are some tips for answering multiple choice type questions. Okay, so first one, always cover up the possible responses with a piece of paper or with your hand while you read the stem or the body of the question. So cover the choices. Read the question first, and then cover the choices and try to anticipate the correct response before you're distracted by seeing the options provided. So sometimes now once you see the choices, all the more you get confused. Okay, that's why what you want to do is read the question first, try to think of the answer, and then that's when you uncover, the possible choices or the options that you have. Okay. Now, if you see the response that you anticipated, circle it if it's allowed, of course, or take note of it, and then check to be sure that none of the other responses is better. Remember, a multiple choice type exam, will only accept the best answer as the correct answer. Okay? There's no rank 2 or rank 3. Okay? There's always the best response for each question. If you do not see a response that you expected, then consider some strategies to eliminate responses that are probably wrong. Okay, so what are these strategies? Okay, let me ano lang. Kasi I'm sure a lot of you have heard, okay, if it's the longest choice, then it's probably the correct answer. Why? Because they would not have, spent so much time writing that choice otherwise, if it's not the right answer. Well, you have this, I know you've heard of this. What else? You've probably heard of, oh, sige, if I'm gonna guess C for Christ. Ganon. Meron ganon, no? So anyway, what are these strategies? Okay? Responses that are absolute words, such as always or never, are less likely to be correct than ones that are conditional words like usually or probably. So when you encounter choices that include the words always or never, no, it's very likely that they are not the correct answer. Gets nyo? Gets nyo? Because when you're talking about science, when you're talking about uh when you're talking about science or you're talking about exams, they wouldn't want to give absolute statements, that can be proven wrong later on. Okay, there should always be room for changes, later. No, that's why they use the term usually, probably, not always or never. No? So even now when I'm talking with you, I would say usually. No, I would always or never. No, because that's what? That's playing it safe that what you're saying will still hold true after years and years, right? And that's also what you will expect, no, from these questions. Okay. Now, if you verify that more than one of the other responses is probably correct, then choose all of the above. Okay. None of the above is usually an incorrect response. No. But this is less reliable than all of the above rule. So be very careful not to be trapped by double negatives. Okay. So double negatives, meaning if you encounter two negative terms in a sentence, they cancel each other out, which makes it positive. Okay, so so English skills are definitely needed, no, for taking the licensure exam, no, and because English is the language of science. Okay, for at least for now. Okay, look for grammatical clues. If the stem ends with an indefinite article like an, okay, for example, then the correct response begins with a vowel because an, no, is followed by a word that starts with a vowel. Okay, an apple, di ba? No? An obturation material. Okay? Okay. So the long response is often the correct one, because the instructor tends to load it with qualifying adjectives or phrases. It's not because, they're not going to waste time, blah, 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 but it's because this is full of details. Okay? Now look for verbal associations as well. A response that repeats keywords that are in the stem or question is likely to be correct. Okay, so if you encounter the same term that's found in the question, then it's a clue. Okay, now if all else fails, choose a response B or C. No, many instructors subconsciously feel that the correct answer is hidden better if it is surrounded by distractors. So usually, letter A, no, will be the least likely as the correct guess. Okay. Now, of course, because I know this, no, I would put letter A as the correct answer also in my exams, deliberately, because I know this subconscious tendency. Okay, no, but yeah, more often than not, we do tend to put B and C as the correct answer. Okay, yeah. Okay, so general test taking tips and testmanship. No definitions and technical terms very well. Again, no definitions and technical terms very well. No, what I usually do is I study the meaning of word fragments. No, so for those of you who have discussed with me, no, you know this. No, I break down words, no, according to the meaning of each component, so that they're easier to understand. Okay, and such that, no, when you take your licensure exam or any of your exams rather, no, other than that, no, when you take these exams, even if you encounter a new word, no, because you have to understand, there are different so many different schools of thought, there are so many different learning institutions, no, that you might actually encounter a term that you haven't encountered before, no, but and you might not understand what it is, but if you're able to break down the parts, then it will help you understand and you will have a better chance of understanding or guessing this correctly. Okay, now look for ways to compare choices, read carefully, and look for keywords in each question. So there's usually the keyword that's that an important component, no, of this question. Read the question and try to come up with the answer yourself, as I said, and then read all the choices. Because remember that only the best answer is correct. Let me repeat this one. No, read the question, try to come up with the answer before looking at the choices, and then regardless of whether you find your answer among the choices, you have to read all of the choices. Why? Because the best answer is correct. Okay, so there might be a better answer than yours. Okay, so before you start answering, make sure that you read carefully and understand instructions. Of course, you use the correct pen or pencil and a good quality eraser if this is allowed. Your test paper and answer sheet are correct, clean, with no stray marks, and complete. No, sometimes these are defective, no, in the licensure exam, so you need to be careful. Of course, know how much time you have to take the exam and manage your time well. Some of you answer too fast. No, so take your time. No, there's no point in rushing. Okay. No, so do you think that you might lose the information? I don't know. No, so anyway, No, so if you're allowed to wear a watch, of course, wear an analog watch. Okay, no smart watches, and know how to use the watch. Man, monitor your time. Mamaya may watch, hindi mo alam ba na gamitin. Monitor your time. For example, give yourself a deadline for the first 50 items and so on. Answer at a steady pace. Don't spend so much time on one question. Don't fixate. Okay? Try to answer questions in consecutive order. Try not to skip. No, otherwise you might uh, actually miss it, and it messes up your answers in the when it's checked, no, in the computer. Mark any questions you are unsure of, only if allowed, of course. Okay. Know how much time you have to take the exam and manage the time well. Check if you have answered one bubble per question, because you might have inadvertently shaded more than one. Okay. Make sure you have enough time to check for stray marks and to eliminate them on your answer sheet. And please review your answers. Don't act rashly and make last minute changes. Usually, no, your first answer is the correct one anyway. No, so as much as possible, use your time wisely. Come up with the correct answer in the first go, and try not to change it, no, unless you're 100% sure that it was actually wrong. Okay. Now, who can help you prepare for your exam? No, definitely you. Okay? Keep yourself motivated and focused. Know yourself. Now you should have introspective self-awareness. What are your standards? What are your habits and traits? What motivates you? What are your desires? What are your aspirations? How are you feeling? Okay? Now use all of these, no, to help you with your exam. No? Recognize your preferred and effective study habits, your study techniques that work for you. No? And of course, keep an open mind to options. No, there are some who will say, "Oh no, I don't, I don't do well in group study," but they've never tried it before. Okay, try it at least once. Okay, now you figure out what works for you, no, and use them. Okay, yeah, uh, yeah. Recognize your strength and weaknesses. Now you have to understand the difference between confident and delusional. Okay, no, and not confident versus unprepared. I've encountered, no, there were some students before who even posted online, "I'm prepared," and she put all her paraphernalia for licensure tech exam, no, took a picture and posted it, only to end up not passing, no, that exam, and even subsequent exams. No, she also enrolled in UP review, no, so but according to her batchmates, she was barely there. Okay? So enrolling in review classes will not make you pass. It's not an automatic pass just because you enrolled. Okay? So you have to have that discipline. You have to have that motivation. You have to be realistic, no? So be confident. No, you want to review enough, no, such that you become confident, not delusional. Okay? Now it's fine not to be super confident, because this is different from being unprepared. Okay? Now if you're nervous, that's fine. No, if you're a bit nervous, you're a bit scared, that's fine. That means you're not delusional. Okay? As long as you're prepared, it's okay. All right. Now I've encountered so many reviewees, no, who would tell me, what if I don't pass, what if I, what if these things will not be answered. No, uh right then and there. You just do your best to be prepared. Okay. Now improve yourself in terms of your health, your habits, no, your memory, no. Hindi ko mabasa ano ba itong nilagay ko dito. This was a bit, yeah. Anyway, yeah. Now, who else can help you prepare? There are other people around you, your fellow reviewees, individually or as a group, past exam takers, no, uh, those who are planning or reviewing for exam, no, and those who have already passed. Okay, not don't hesitate to ask. Okay, don't hesitate to ask for tips. Of course, what they say, you also take with a grain of salt. No, not everything they say is 100% accurate or correct. Some are just a matter of perception. Also, when you, yeah, so review schools, no, enrolling is never a guarantee for passing. Of course, your teachers and your school, Fatima, is here to help you. No, our college has been providing free review classes. No, your our university, no, is providing time, effort, and the salary of your lecturers, no, without you having to pay for anything extra. No, this is not the same in other schools. No, in other schools, they will pay for their review sessions. During my time, we weren't allowed actually to review elsewhere. That's all in house. Okay, no, but we saw that for some they need to review outside so that they get more confidence, so that's fine. Okay, but for some students they don't really need to review elsewhere. They still do very well in the licensure exam, but it will, if it will help with your gaining confidence, then fine. It's okay. No, um but make sure, know that you try to attend, all the review sessions that we have. Okay, yeah. Now, yeah, ask for help. No, this is no time to be shy. Ako lang pwedeng shy, di ba? No, this misplaced hiya leads to mediocrity instead of being, great. No, you will just be there in the middle, and it's not safe. No, if you're just targeting mediocrity. This is a very common trait among Filipinos. Okay, nahihiya ako nahihiya ako, and then we're hiya about the wrong things. Okay, no, so uh, when you're not doing anything wrong, you're not doing anything illegal or immoral, there's no place for hiya. Okay, no, don't be hiya of doing hard work or appearing like you're working hard. Some we have this culture of uh being afraid of appearing to work hard. No, so we hide working hard. No, meron ganun no, na hindi naman ako nag-aral, hindi naman ako nag-effort, sakto lang, no. So so what happens, no, is that you're exerting extra effort trying to hide your hard work, no, when you should be focusing on actually doing it. No, don't be too shy to ask questions. There's no place. This is not the place for pride. Okay, don't be too shy to ask for or receive help in one form or the other. So as I said, if you need help from your family, no, go ahead and ask. Okay, go ahead and ask. They will uh in almost all, I'm not saying all 100% because I know there's always exceptions, but in almost all situations, no, your family members, no, will be helping you. So your parents, siblings, spouse, children, no, your friends, boyfriend, girlfriend, get these people on the same page. When I say get them on the same page, they should know that you are prioritizing your exams. Okay? This is the most important thing right now. Don't distract me. Don't give me your problems. No, you're supposed to be helping me. No, so because there are some, no, who have the tendency to sabotage, no, and some people are just like that. No, some are bi, some will suddenly introduce drama into the situation and cause you to get distracted. So get these people on the same page, let them know this is my priority right now. Okay, if you're not on the same page with me, just get out of the way, don't bother me. Okay, so they need to know you have deadlines, schedules, and goals. They should avoid distracting you or tempting you. That you need time, you need a good review environment, you need their support, whether it's financial, physical, if somebody needs to drive you around, right? Mental, emotional support. Okay? Now be clear. No, don't make them guess. Now some of them, a lot of us don't have relatives who had to take licensure exams. A lot of us don't have relatives who took dentistry. No, so it's something that might not be uh, within their imagination. Okay, of how to deal with. So you need to communicate very well what you need. Okay, again, don't hesitate to ask for help, but take extreme pieces of advice with a grain of salt, because there will be some individuals who would advise you on things that are a bit extreme. So be very careful as well. Okay. End of the day, your motto should be no regrets. Okay. This is important. Okay. No regrets. When you look back, okay, I tried everything. Okay. I did everything to the best of my ability. Okay. And whether it works out or not, there are several factors that get into it. No? Yeah. So work hard and reap the benefits. We're all rooting for you. Good luck. God bless. Okay? So this is an orientation that I give for review piece. Yeah. No? So I hope that you learn from this. Do you have any question? Yeah, anyways, again, so we will be using what we've learned here. Okay, I hope you apply them, no, especially those who are preparing for licensure exam, and when you do prepare for a licensure exam. No? So because some of you don't have, maybe will not be taking, I don't know, because I see international students here. Okay, so I don't know what their plans are. Okay, um and it's very important, not for you to remember what your goals are and to focus on them. There are so many things that can happen, that can go wrong, and that's part of it. No? That's why I always say, uh, passing, graduating, completing your requirements, uh, in the undergrad level, no, and passing the exams, passing the licensure exam. There are so many factors that come into play. So um, I hope that uh, even if you don't do very well or as you expect, that you don't lose hope. No, I've seen situations wherein they did not pass the first time, and then they waited so long before taking the exam again. So it's because they lost confidence. You have to remember, these our patients wouldn't really ask, did you pass on your first take, or were you a top notcher? Also, don't put too much pressure on yourself. Uh, so those of you who are doing very well, then good. Just go ahead, forge ahead. And those of you who think that you still need to work more, then yeah, no, if you think that you didn't do very well when you were studying your courses, no, then now's the time. No, you're preparing for graduation. You're preparing for your licensure exam in combination, right? No, so uh, this is a very good opportunity, no, that you still have some time, okay, to try to catch up, okay, and use what I discussed with you for this first part of the discussion. Okay, now let's see. We'll be doing our item analysis. Yeah. So this is the one that Dr. Razon usually, I think, gives. This came from different review materials and whatnot. So of course, this did not have answers. Okay, so all right. Can you read? No, I need to make the text bigger. Kailan ko ba palakihin yung words? Where's the magnification here? Ayan. Okay, let's start. So why is chemical irrigation and disinfection considered crucial in root canal treatment, especially in challenging or morphologically complex cases? And what's your answer? Bilis ng sagot letter C. All right. So let's look at the choices, no? So most of you, I think your answer is letter C, which is correct. No, but let's see it. Let's look at the choices. It helps reduce the cost of endodontic procedures. Not really. Doesn't of course, if you use an additional item, it adds to the cost. It allows clinician to skip mechanical instrumentation, which is of course not recommended. No, we don't skip mechanical instrumentation. It plays a vital role disinfecting areas that are difficult or impossible to reach mechanically. So this one makes sense. No, kahit na may comma siya sa dulo. I don't know why it has a comma then. But yeah, it makes sense. No, because there are some areas that your files won't be able to reach. Okay. Letter D, it eliminates the need for radiographic evaluation of the canals. Definitely not. No, radiography is essential in endodontics. Okay, next item. Which of the following is not included as an outlined objective in the course on root canal irrigation and disinfection? Now, this is a very weird way of asking. No? Medyo strange yung question niya. No? Which of the following is not included as an outlined objective? So, maybe you can remove yung outlined objective, no, in root canal irrigation disinfection. So this is the main topic, root canal irrigation disinfection. Okay. So what are their choices? So of course, because this is which of the following is not included, so we can't do the guessing before coming up with the answer beforehand. Now we really need to look at the choices one by one. Describe the properties of an ideal root canal irrigant and evaluate irrigation techniques. Letter B. Identify and apply principles of ultrasonic devices and root canal cleaning and shaping. List the steps in fabrication of permanent crown following root canal therapy. D. Discuss the role and properties of intracanal medicaments and chelating agents. So actually, easy to right? Yeah. No, so this letter C is totally out of topic. Okay, so it's actually easy to answer. Okay, next, number three. Why is root canal treatment or therapy generally more successful in teeth with vital pulp compared to those with necrotic pulp? Of course, there would be some who will argue against this statement, but yeah, if you're asked this, why is root canal treatment generally more successful in teeth with vital pulp compared with those with necrotic pulp? Okay, so let's look at the choices. Vital pulp tissue is easier to anesthetize and remove. Well, you don't really need to anesthetize non-vital, right? Teeth with necrotic pulp require fewer appointments. That's also questionable. The presence of necrotic tissue and microorganisms make complete disinfection more challenging. Okay. D. Teeth with vital pulp do not require any chemical irrigation. So you already have a statement here that you can definitely remove. Which one? Teeth with vital pulp therapy do not require any chemical irrigation. Why? No, uh, because this is uh, an a statement that's extreme. No, do not require any chemical irrigation. So it means that never, no, will you require chemical irrigation with vital pulp therapy. And we know that this is not true, of course. No, so that's already eliminated among the choices. Okay. Now, vital pulp tissue is easier to anesthetize and remove. Again, no, of course, vital pulp tissue is the one that you anesthetize, right? No, but when you're talking about, is this a rationale for successful treatment? No, not really. No. Teeth with necrotic pulp tissue require few appointments. Not, it's not necessarily true either. No, as a matter of fact, no, a lot of cases with necrotic pulp tissue, no, will have periapical lesions. No, so um, it is common practice, no, to ensure that the canal is dryable before we will uh, obturate. So definitely, no, this will be something that will cause delays. Okay. No? So and besides, this statement is counter, no, to the question, because the question is asking why is root canal treatment generally more successful in vital pulp. No, so this means that you're looking for the advantage of vital pulp. Okay. No, the presence of necrotic tissue mechanisms make complete disinfection more challenging. So that's why the answer here is letter C. Again, if you look at this question, no, you're looking for an answer that will promote, no, that will prefer treatment of vital pulp tissue. Okay? So that's why you need to understand the question. Okay? So this thing, no, this the question itself will already help you eliminate some of the choices, because some of them, no, like letter B, no, actually is claiming advantage for necrotic pulp. No, when in fact what you want, what you're looking for, no, based on the question, is advantage of vital pulp. Okay? Did you get that? You understand? No, so that's how you look at questions. No, you don't just uh, read the question literally, but you need to understand what they're looking for. Okay. No? So what is this trying to ask of me? No, so this question is asking me, no, why is it better, no, to treat vital pulp compared to necrotic pulp? What is there has to be some advantage. So even if you don't agree with this statement of vital pulp RCT is generally more successful than necrotic pulp RCT. Okay, so focus on the question itself. Number four, what is the primary role of chemical agents used as adjuncts during root canal procedures? So, primary role, meaning the top, the most important role, because there are many roles of your chemical agents. No? So, what is the primary role? Let's look at the options. Options are to replace mechanical instrumentation entirely. Of course, we don't do that. To eliminate microorganisms and reduce canal contents while aiding in pain and infection control. Letter C, to harden dentine and seal the canal walls permanently. D, to enlarge root canal space beyond its original anatomy. Okay, let's see. So I received answers saying letter B. Okay. So we can eliminate letter A immediately, because this is not something that we want to do. You do not replace mechanical instrumentation, no, with chemical agents. Okay. Now letter B makes a lot of sense, because these chemical agents, no, will eliminate, no, these pathogens. Okay. No? Letter C, to harden the dentine and seal the canal walls permanently. Of course, this is not something we want. Again, no. Letter D, to enlarge the root canal space beyond its original anatomy. Now, this could be no, a possible option, but no, letter B is definitely the best, no, out of all of them. Okay, yeah. Now this is why you really need to read the options. Okay, now next, number five. Which of the following is not a desirable property of an ideal root canal irrigant? So let's break down the question first. Now uh, you know what are the ideal, so what are the properties of an ideal root canal irrigant? Okay, so what you're looking for, no, among these choices, no, is shouldn't be on that list. Okay, yeah. So this that's easy enough. Okay, so high toxicity to ensure complete microbial kill. Yes, you want to kill all the microbes, but no, do you want high toxicity? Okay. Letter B, possesses low surface tension to aid penetration. Letter C, effective in dissolving organic tissue. Letter D, help flush debris and remove smear layer. Okay. So, again, no, when we're talking about ideal, no, ideal, it means that if it's possible to have these properties, no, in the root canal irrigant, then by all means it's going to be perfect, it's ideal. But in reality, of course, we don't have an ideal root canal irrigant. Okay, now this is just uh, our fantasy root canal irrigant, so to speak. Okay, when you say ideal, parang ano rin yan, your ideal woman or your ideal man doesn't exist. Okay, so yun. Now, so the answer here is letter A, because definitely letter A is not something desirable because of the term high toxicity. Okay, high toxicity is never desirable. No, in I rarely say the word never, but it's never a good thing for root canal irrigant. Okay, anyway, actually the second part of the statement is acceptable, right? But the high toxicity is the one that killed that option. Anyway, number 6. Now, which of the following statements about chemically non-active irrigants is true? So this means that out of these choices, only one is true. Again, no, it's important to understand, no, the way that the question is asked. No, so again, which of the following statements about chemically non-active irrigants, non-active, chemically non-active irrigants is true? So again, all of these choices are wrong, are false rather, except for one. We're just looking for this one true statement. Letter A. Distilled water is commonly used for disinfection because it can dissolve organic tissue. Eh. No, right? Letter B. Saline solution is ideal for necrotic cases due to its strong antimicrobial properties. Does a saline solution have antimicrobial properties? Minsan may nagdi-discuss sa akin ng endo, yun ang sinasagot eh. No, NSS daw has antimicrobial properties. Anyway, letter C. Anesthetic solutions can be used to help control bleeding after pulp extirpation. Pwede. Why? No, because there's still the possibility of some residual blood there and some residual vessels there. No. Letter D. Chemically non-active irrigants are the first choice in all types of root canal treatments. Of course not. No, our first choice still is and remains to be sodium hypochlorite, which is an active, chemically active irrigant. Okay, so the answer here will be letter C. Okay, huh? All right. Number 7. Which of the following best describes the role of human microbiome? So the microbes, no, no, that we have, the role of human microbiome. Letter A. The microbiome is mostly harmful and needs to be eliminated to maintain health. Letter B. The microbiome consists of viruses that attack human cells and cause disease. Letter C. A balanced microbiome supports human health, but imbalance can lead to opportunistic infections. Letter D. The microbiome has no significant impact on the human body's health and function. Let's see. Let us see your answers. Okay. Okay. Any other answer? Okay. So the answer here is let's look at the choices. No, this is also very relevant. Um, even in the idea of the use of antibiotics. No, because the there has been a paradigm shift, no, over the decades. No, before, no, decades ago, the goal was to kill everything. No, kill all microbes. Kill no. Uh, we want everything sterile. Blah, blah, blah. No, but in fact, we've found out, no, that we need these normal flora. We need, no, to maintain the microbiome, no, that's not harmful, no, so that we have homeostasis. Okay, it's important to our health. Now, otherwise, if we eliminate everything, no, if we eliminate everything, no, that the microbiome that's on our tissues or in our tissues, what we are doing is actually providing, no, space for opportunistic microbes. Okay, so now this is an important paradigm shift that occurred. Okay, yeah. So the answer here is letter C. All right. Okay. Number 8. Which of the following correctly lists the 5 phases of patient management? So this is no, this is also a topic in ODAI and all that and other courses. Okay. No, so let's look at our options. Of course, we know most of them. Okay, these are so let's see. Assessment, diagnosis, treatment planning, treatment implementation, evaluation. This is when you say evaluation, evaluation of the treatment or management. Letter B, examination, diagnosis, surgery, follow up, recovery. This is a bit too specific. Okay, no. Um, and letter C, consultation, imaging, medication, surgery, reassessment. Again, too specific, and besides, imaging and medication might not be applicable in all situations. No. Letter D, patient history, clinical examination, all of them are part of your assessment. Anyway, laboratory tests, again, not necessarily true for all cases. Treatment and discharge. So, this means the best answer is what? Tama, letter A. Okay? Yan. Number 9. Just scroll a bit. Oops. Lumabas. Number 9. Which of the following statements is false? Minsan delikado to mga question na ganun. Which of the, kasi when you see a question like this, which of the following statements is false, or which of the following statements is true, you have no choice but to really read all of the choices carefully. Okay? No? So, letter A. Oral diagnosis involves the systematic identification and determination of the existence of a particular oral pathosis. Letter B. Oral diagnosis is primarily based on patient history and clinical examination. Letter C. Oral diagnosis does not play a role in identifying oral diseases. Letter D. Accurate oral diagnosis is essential for effective treatment planning. Okay, this is easy. No? Once in a while, you will have questions that are this easy to answer. No? Just look for, based on this question, all of these statements are true except for one. Okay? So, that means letter C. No? Easy, no? Sana lahat ng question lang easy. Anyway, number 10. Number 10. Which of the following statements about treatment planning is false? Again, now this means that all of your choices are correct except for one statement. So let's look for this wrong statement. Okay? No, so, or the false statement. Letter A, treatment planning involves sequencing general treatment procedures based on understanding the disease processes. Letter B, effective treatment planning requires understanding the relationship between different disease processes. Treatment planning is unrelated to understanding of disease processes and their interactions. D, a well organized treatment plan helps ensure comprehensive patient care. Again, this is quite easy. No? Letter C. Alright. No? So, sana nga ganun lang lahat ng question, no? Pero, wishful thinking. Anyway. Hindi ko ma-imagine si Dr. Porter na ganito ang question. Dr. Porter was my teacher in one of my teachers in oral histology. So, at saka, of course, I've attended her lectures. No, she's very exacting. No, she's a very exacting person, very demanding person. No? But the last time I saw her, she attended yung ESP lecture last March 28. Siyempre tanda ako, no? Last March 28. But she arrived late. Siya kasi pwede malate. Pag ibang tao, hindi pwede malate. No? Pero kasi board of dentistry siya. So, the Honorable Dr. Irene Porter was late. But she appeared very positive, very cheerful that day. So, which is good for everybody. Anyway, let's see. Number 11. Which of the following describes differential diagnosis? So, of course, if you don't know what differential diagnosis is, edi lagot. No? So, you have to know what it is. Letter A. The process of confirming a single definitive diagnosis without considering other possibilities. This is like the total opposite, right? Anyway, letter B. The systematic comparison of clinical features to distinguish between two or more possible diseases or conditions. The first step in treatment planning after diagnosing the condition. Well, you've already, this means that based on this statement, letter C, you've already diagnosed. So parang it doesn't make sense. Letter D, the process of selecting the most common disease in population regardless of symptoms. Now, of course, diagnosis should not be based on popularity. So this happened a lot, no? Especially during the pandemic, no? Everything became COVID-19, no? Kasi siya yung uso, no? Everybody was just thinking of COVID-19, no? So every respiratory disease became COVID-19, no? But in actuality, no, of course, it's not true. Okay? So, yeah. You don't disregard the symptoms. You have to be objective. And then, of course, which one best describes differential diagnosis? It's letter B. Okay? And, oops. All right. Let's go to number 12. Kasi ang haba ng choices. Okay. Number 12. Which of the following best describes the components of history of present illness? So again, of course, we have to know what HPI is. No, if you don't know what HPI is, then you're in trouble. No? So, ayan. Letter A detailed account of past medical history, family history, and social history. This is, this is not HPI. No, but I have encountered some students who thought that the medical history or the medical history is or dental history is the HPI. No. Okay. So let's see. Letter B. Chronological details of pertinent events leading up to the chief complaint, including localization, commencement, intensity, provocation, relief, and duration. So, yeah, these are the details that you include in the HPI. Letter C, a review of all current medications and allergies. No, this is your medical history. Well, this is part of medical history. Letter D, an assessment of the patient's overall health status and lifestyle choices. So this is more of social history. Okay, so the answer here is quite easy. Letter B. Right. Okay. Number 13. According to the the American Society of Anesthesiologists Physical Status Classification, which ASA class describes a patient with severe systemic disease that poses a threat to life? Of course, by now, memorize nyo na to, no? Yeah, letter D, as a 4. Excellent. Kung ganito na yung mga question, kaya nyo yan, no? Number 14. The clinical examinations are procedures performed to assess various health conditions. Which of the following statements best describes the purpose and components of clinical examination? So let's focus on clinical examination. A. They are solely used to evaluate intraoral health conditions through visual inspection and include tests like percussion and periodontal probing. Letter B. They are procedures to assess both extraoral and intraoral health conditions, providing critical information for diagnosis, including assessments like gait analysis and periodontal pocket measurements. Letter C, they focus only on systemic illnesses by examining the patient's gait and extraoral parameters, neglecting intraoral conditions. Letter D, they are limited to visual examination of intraoral tissues to detect sinus tracts and soft tissue swellings and without considering other diagnostic tests. Answer? Madali lang to eh, no? Letter, letter B. Okay, letter B. So that's why you need to read the choices. No, otherwise you'll get lost. No, you could get misled. Okay. Oops. Number 15. The dynamic between the host and microorganisms. As I was mentioning earlier, homeostasis. This is in relation to equilibrium as well. Constantly shift favorably due to local factors like poor oral hygiene, systemic conditions such as diabetes, increased risk of oral disease. Of course, this is opposite. No, this is not favorable. No, so false. Easy to answer. True or false lang to eh. Okay. Number 16. Number 16, the initial occurrence of apical periodontitis. Okay, ito endo na to. The initial occurrence of apical periodontitis is a symptomatic lesion where there is no clear distinction between asymptomatic infectious inflammation. It is detectable radiographically. Neutrophils are attracted to the area by chemotaxis induced by tissue injury. Bacterial products and complement factors, which are plasma proteins that react on the surface antigens. Okay, so let's break this down. Because actually, look, if you look at the choices, your choices are the first statement is correct, the second statement is correct, both are correct, neither are correct. So if you find that one of these two is incorrect, you already know that letter C is eliminated. Okay? No? So, yun lang yun. So, the initial occurrence of apical periodontitis is a symptomatic lesion where there is no clear distinction between asymptomatic infectious inflammation. Hmm, asymptomatic na nga yun, so you will know, no? So, how can how can you say that there's no clear distinction between symptomatic and asymptomatic when it's already symptomatic? No, that's the name itself will tell you that they're clearly distinguishable. Okay? No? So that makes this statement wrong. So let's look at the actually kasi this this question is incorrectly fabricated or incorrectly constructed. Why? There should be a separation between the first concept and the second concept. I'll show you, no? Dapat hiwala ito eh. Yan. Okay? So, kasi these are two sentences eh. Uh, it is detectable radiographically is the second sentence. But, the third sentence is a different concept. Okay? That's why they should be separate. No? So, ayan, dapat ganyan yan. Neutrophils are attracted to the area by, kasi we know that the first statement is already wrong. Okay? Now, let's look at the second one. Neutrophils are attracted to the area by chemotaxis induced by tissue injury, bacterial products, and complement factors, which are plasma proteins that react on surface antigens. So, neutrophils are the number one, no, the first in line. Okay? No? So, here, what's your answer? We already know that it's not C and D. We already know that it's not A. So, the answer is letter B. So, nagets niyo yun? As soon as you found no, that one statement is wrong, you already eliminated both of the statements is correct. No? And you've already eliminated that statement. No? So, you just need to check the second one, whether it's true or not. Okay? Yan. Alright. So, number 17. Number 17, when infection is involved, neutrophils will attack and kill microorganisms and release leukotrienes and prostaglandins, which are lipid mediators derived from arachidonic acid that play crucial roles in inflammation, pain, and immune regulation. Or yeah, immune regulation. Okay. Second, administration of indomethacin, a non-steroidal anti-inflammatory drug, produces potent analgesic and anti-inflammatory effects by activating cyclooxygenase to enhance prostaglandin synthesis. Mm. Ano ba to? Do you know what indomethacin is? That's the problem, no? Okay? And how is this related to cyclooxygenase? Okay? Does it do you actually want medication that will activate cyclooxygenase? 'Di ba the meds that we get nga for anti-inflammatory will be COX-2 inhibitors, 'di ba? No? Which will reduce PGE. Tama? PGE2. So, this statement is Uy, tama ba? Baka ako yung mali. What's indomethacin? And well, if you don't know what indomethacin is, no, kasi syempre, of course, there are a lot of different NSAIDs. So that's assuming you don't know what indomethacin is. But it states here that it's an NSAID, okay? And that this NSAID, no, activates cyclooxygenase or COX, di ba? And uh, this will therefore enhance prostaglandin or PGE. Oh, which is not true of NSAIDs, di ba? No? So, yeah. So indomethacin, no, produces analgesic and anti-inflammatory effects, which is a COX-2 inhibitor and reduces PGE2 synthesis. So, the answer for this is letter A. The first statement is correct. Nag-guess nyo? Nag-guess nyo kung bakit ganun? Did you understand how that became the answer? Okay, sige. No? Medyo ano, no? Kasi if you see the name of indomethacin and you're not familiar with it, you might get scared na. Diba? No? Do you get the, did you get yung feeling na yun? Parang, huh? What's that? What's indomethacin? But if you read the rest of the statement, no, you will see where there's error. No? And that will make the statement incorrect or false. Right? Okay. So even if you don't know what indomethacin is, as long as a part of that statement is wrong, that's already incorrect. Diba? So yeah, that will already help you with your answer. All right. Next. So hindi lang endo ang inaaral natin. We're not just reviewing endo, but we're also reviewing test taking skills. Okay? Because a lot of you, no, actually a lot of you you study really hard, 'di ba? You've read your notes, you've read your books, but still you don't perform well in the exams. Why? Because you don't know how to take exams. Now I know some people like that, kasi they don't know how to take exams. No, so test taking is also a skill. Okay? Yan. Next. Number 18. The acute lesion may take the following possible courses: spontaneous healing, formation of an alveolar abscess as it intensifies and spreads into the bone, or transition into a chronic type with sinus tract formation that creates an external opening. Which of the following phrases made this statement false? Ayan, this is ano, no? Now you need to find out, no? Is the entire statement true? Kasi if you look at the choices, it says none of the above. Okay. No? But no, if the entire statement is true, no, then that's the it's impossible. So there's one here that's false. Diba? Kasi which of the following makes this statement false? So lahat to true. Lahat to the entire statement rather is false. But it's just one component which makes it false. Hindi lang nga, mali kasi yung formulation tong question. Una, iwalay siya dapat. Tapos, dapat ganyan. Yan. Okay. This makes it easier to read. Okay, again, no? So if you look at the entire statement, no, and you realize based on the question that this statement, the above statement is false, okay? Then alisin nyo na yung letter D, no? Remove the letter D na, okay? Kasi yung question nyo, which makes it false eh. So the claim already is that it's false, no? Kasi if you say, which of the following phrases made the statement false, and then you answer none of the above, okay? The question itself is wrong, right? No? So this statement, the above statement, is false. There is just one of them that will be the primary cause of making it false. So definitely eliminate letter D. Okay? Nagets nyo yung reason ko? Na bakit wala na, definitely letter D is not among them. Anyway, so let's look at the statement. The acute lesion may take the following possible courses: spontaneous healing, that's one. Formation of alveolar abscess as it intensifies and spreads into the bone, or transitions into chronic type with sinus tract formation that creates external opening. So you have three possible choices here, di ba? No? Is it spontaneous healing? Acute lesion, ah. Will an acute lesion lead to spontaneous healing? What do you think? Formation of the alveolar abscess that intensifies and spreads into the bone. Letter C, transition into chronic type with sinus tract formation that creates an external opening. Can you just, let go of an endodontic lesion, no? Acute lesion, ah. Sabi dito, acute lesion. Can you just let go of an acute endodontic lesion and pray that it will undergo spontaneous healing? Pwede ba? Uy, sumagot kayo. Will it happen? No, acute lesion, nag-spontaneous healing. So the answer here is, ano answer here? Let me see your answers. Oh, hala. Nakatulog na yata. Any other answer? Ang sabi kasi sa statement na to, now what the statement is saying is that an acute lesion may undergo these three, yung choices themselves, no? Spontaneous healing, formation of alveolar abscess as it intensifies and spreads into the bone. Pwede rin mangyari transition into a chronic type with sinus tract formation uh, uh, that creates an external opening. Ayan. Okay. So, yeah, you need this statement, no? If you accept spontaneous healing kasi, that means you don't need to treat. Pwede naman pala mag-spontaneous healing. 'Di ba? Pero, no, an acute lesion could intensify, no, in its acuteness, or it could become chronic eventually. Especially kung ano, initially, for example, the case presented with systemic signs of infection, you prescribed antibiotics, no? And after that, it will become, no, chronic type na kung na-resolve na siya, no? It could, right? Or the patient's immune system itself, no, could transition it from acute to chronic. Pwede yun, ha? No? No? So that's why you need to understand yung disease processes eh. No? But definitely, spontaneous healing of an acute lesion is not something that you will expect. So the answer here is letter A. Okay? Yan. So, yan. Number 19. So, ganun na, we're not just discussing here the concepts, no, but also how to figure out no, the answer, how to come up with the answer. Okay. Number 19. Which of the following principles should be observed during periodontal examinations? Take note, no? Whether it's number one, endo and perio belong to the same cluster. Number two, even if you're talking about endo, you also do periodontal evaluation before you start and at the end before you do your uh, final restoration. You do periodontal evaluation. Okay, anyway, now, which of the following principles should be observed during periodontal examination? Letter A, record periodontal pocket depths only on the buccal surfaces, ignoring mesial, middle, and distal aspects. B, wide span or coverage of periodontal bone loss is typically considered to be of periodontal etiology, whereas isolated vertical bone loss may be of endodontic origin. Letter C, pulp testing is unnecessary in periodontal examinations as it does not contribute to diagnosis. Letter D, only clinical observation of soft tissues is required. Radiographic assessments are not needed. Okay. Now, this is a bit tricky, no? Kasi what are they talking about ba? Okay? So if we're talking about endo, no, treatment or management of a patient, but the periodontal examination part, then definitely, no, letter C will be wrong. 'Di ba? No? So so pop testing will definitely be necessary, no? So wrong na agad tong letter C. Okay? Uh, Letter D, only clinical observations of tissues required. Radiographic assessment are not needed. No? Again, no, this will be tricky, no? Because if you do not see if you're just talking about periodontal disease, then and if you do not see any reason to take a radiograph, no, then yeah, radiographic assessment will not be needed. But no, uh, it's not of course true all the time. No, in cases wherein you see that radiographic evaluation is needed, no, when you have, for example, deep pockets or obvious amount of bone loss or attachment loss, then you will do radiographic assessment, di ba? Again, in the endo concept, definitely radiographic assessment is 100% needed. Okay, so that's no question. No, there's no question of that. Okay, let's go for letter A. In letter A, record periodontal pocket depths only. No, we record or we at least assess, no, the periodontal pocket depths all around. Okay, no. Letter B, wide span or coverage of periodontal bone loss typically considered to be a periodontal etiology, whereas isolated vertical bone loss may be of endodontic origin. Take note, no, this is not a statement that uses never or always. So this is a safe statement, right? No? So, no, kasi tingnan niyo yung letter D. Letter D is only scary yan. Okay, when you see that, no? So when you see very definite statements, you should be wary of this. No? Yeah, record periodontal patients that periodontal pocket depths only on buccal surfaces. Again, be wary of such statements. When you look at letter B, no, it's pretty long, so that's a good clue, di ba? So you have a lot of qualifiers here, no? So it's comparing now wide span, no, periodontal bone loss versus vertical bone loss. Okay, so while vertical bone loss, no, could also be periodontitis, di ba? It could be of periodontal origin, I mean, no? But yes, it could be of endodontic origin. No? So when you insert your probe and it suddenly goes down very deep, no? And what you have there is a tooth that has either a large restoration or a tooth with possible pulpal involvement, no, because you have large caries, then you can suspect, no, that this is actually of endodontic origin. Got it? And in the hand. So letter B is the answer here. Right? Okay. So you don't just read the question and the choices, but you also think of the perspective of where this question is coming from. Okay, what's the point of this question? Number 20. Which of the following statements accurately reflects principles observed during periodontal examinations? Okay, which of the following statements accurately reflects principles observed during periodontal? Yeah. Perio pockets associated with primary endodontic tissues typically resolve after endodontic treatment. Letter B. Vital teeth with deep periodontal pockets will usually resolve the periodontal problem following endodontic therapy. Hmm. Letter C. Vertical root fractures can cause localized narrow periodontal pockets deep within the root surface. Mhm. Letter D. Furcation bone loss is always solely due to periodontal disease and never related to pulpal tissues. Okay, let's see. Let's see your answers here. Magandang question to. I like this question. Let's see. What's your answer? Number 20. Hmm, Sige, answer pa. Dalawa pa lang sumasagot eh. Who else? Sagot pa tayo. Huwag kayong mahiya. Hindi ko naman kayo judge. Ano to eh, you want to be honest with yourself, no, and see the thought process that's going into your decision. Okay? I'll walk you through naman eh. Kasi we want to challenge ourselves, no, to think, no, so that we're prepared to answer these questions. Dami-dami nyo. There are more than, yeah, there are 40 something. So, wag naman isa lang sasagot, you know. Anyway, all right. So, let's see. Letter A, no? Periprockets associated with primary endodontic issues typically resolved after endodontic treatment. So, when you say periodontal pockets associated with primary endodontic issues, so you have two situations. You have a primary endo issue, so there's really an endodontic disease or condition, but there's also a perio pocket. Okay, do you just treat the endo issue, or do you need to also address the pocket? Okay, so here, no, I have to say, you need to remember, you also need to address the periodontal pocket. Okay, yes, we treat the endo first usually. Okay, but but we need to also manage the perio problem. Okay? All right. Letter B. Adult teeth with deep periodontal pockets will usually resolve the periodontal problem following endodontic therapy. Definitely, this is not correct. Okay? Why? No? Eh, okay nga yung okay nga yung ano eh, 'di ba? Vital teeth nga. Although it doesn't say whether the tooth is pulpally involved, no? But no, this means that these are two separate components. They are not related to each other. No? So definitely the endodontic therapy is necessarily needed, no, in this case. Okay? Pulpal involvement. Okay? Letter C. Vertical root fractures can cause localized narrow periodontal pockets deep within the root surface. Okay, so this is actually possible. Okay, so when you see a narrow periodontal pocket, you have to consider the possibility of a vertical root fracture. Okay, so this is why you also don't want to immediately do root canal therapy, no, just because you saw a narrow periodontal pocket. Kasi 'di ba? Remember in our previous item number 19, no, it mentioned a narrow pocket or a vertical pattern, no, will be associated with an endo problem. But no, it it could be a, yes, an endo or a pulpal problem, but it's not something, in the case of vertical root fractures, it's not something that can be resolved with RCT anymore. Okay? No? Ayan. Letter D, frication bone loss is always solely due, ayan. Of course, like I said, you already saw always. Dun, dun, dun. Never. Dun, dun, dun. So, ayun. So, you have to be careful when you see these statements that have always and never. In all likelihood, they are not the right answer to this question. Okay? So remember that, no, we're applying what we learned from the from the coaching that I did earlier, no, in terms of answering multiple choice type questions. Okay? So, the answer here is letter C. Okay? No, kasi it's asking for it's asking for accurate statements. Okay? And you have to be very careful, no, when you're doing, take note to, kasi nga this is periodontal examination in the context of endo, right? No, so this is not periodontal examination just in the context of periodontal disease. But we're talking about periodontal examination in the context of endo. And this is why, no, the vertical root fracture is of concern. Okay? Di ba? No? So, ano siya? Your way of thinking, no, has to adapt to the situation. No? No, kasi nga, when you take your board exams, no, when you take your licensure exams, when you take your TCAP exams, no, it's a combination of everything. No, you can't say na, okay, I just want questions that are focused on this one subject. No, it's a combination of so many things. Okay, all the time. And that's true also when you have your clinical practice. No? When you have your own clinical practice, or when you become licensed dentist and you treat patients, you have to think of the entire of the case in its entirety, of the patient in his or her entirety. No, you can't just think of one specific issue. Okay? Yeah, so yeah. Next. Let's see. My mouse is so difficult to manipulate. Ako ba? Let's see. Oops. Sorry, please. What you're me. Let me reduce my window. Labas mo kasi kanina. Okay. I'm making a lecture din kasi. Ang dami ko rin ako bukas. Go to number 21. Okay. Number 21. Radiographic examination, true or false lang siya, no? So, radiographic examination provides a two-dimensional image of a three-dimensional object, and for maximum information, the third dimension must be visualized and interpreted. So if you can, yeah, no? So, very simple. Answer here is true. Okay. Number 22. Regarding pulp vitality examination, which of the following statements is correct? Okay. A. All pulp vitality tests should be performed in every case, regardless of clinical situation. B. If If a tooth is already known to be non-vital, pulp vitality testing should still be performed to confirm. C. Not all pulp vitality tests are appropriate for every case, and some tests may have different levels of reliability. Letter D. Pulp vitality testing is unnecessary if the patient reports no symptoms. Okay. Yeah. So, which of the following statements is correct? So this might be a bit challenging, diba? No, because um as students, no, you were training, no, to do pulp testing on the involved tooth, regardless of whether it's obvious that it's necrotic or not. Okay, no, but no, in actuality, no, in there are situations wherein it's just going to add to uh, the cost, the stress, no, uh, if you perform it. Yeah. So, yeah. So again, these these statements, no, are all false, no, except for one. Okay, again, regarding probability testing during dental examination, which of the following statements is correct? This means that all of the statements here are false except for one. Okay, so let's go. Letter A, all pulp vitality tests should be performed on every case, regardless of clinical situation. Is it true or false? Siyempre hindi. No, you don't need, you don't need to perform vitality tests all the time. Okay? If a tooth is already known to be non-vital, pulp vitality testing should still be performed to confirm. Mhm. I just said it, no? No, you don't need when it's really, really obvious. Okay? No, letter C. Not all pulp vitality tests are appropriate for every case, and some tests may have different levels of reliability. Okay. Now you need to assess this one. Okay? No, kasi for our clinical practice na in private clinical practice, okay? You cannot you do not have that much time, especially when you're employees, you know, and you don't have all of the resources also available. But and uh yeah, your pulp vitality tests, you should know what they're for. Okay? So for example, which tests are for vitality? Pulp vitality or health? Heat test, cold test, EPT. Okay? Ideally, you want to know, you want to use both cold test and EPT. Okay? Again, when you see, that when you only do EPT, mostly what you get is just whether the pulp is vital or non-vital. There could be several degrees of vitality, but it will show you vital, non-vital. That's the most accurate component of it. EPT still has inaccuracies. Okay, cold testing, is most reliable in terms of the pulpal condition, but the problem is, you're only testing actually, the mostly, the pulp condition at the chamber. Okay, not really at the canals. Okay, heat test, no, will be positive both for vital and non-vital sometimes. Okay, no, so definitely they have different levels of reliability. Okay, and in some cases, they don't really they don't really present, with the complete picture. Okay, that's why you need all of the information, from your patient. It's not just the testing itself. Okay. Letter D. Pulse vitality testing is necessary if the patient reports no symptoms. Well, if you already see that there's a large cavity there, then you need to do vitality testing. Okay. Even if the patient presents no symptoms. Why? Because, there could be the patient could have a condition that we call asymptomatic irreversible pulpitis, and this patient, will not present or report symptoms. Okay, so how do we know that it already has irreversible pulpitis? um, Only through pulp vitality testing. So again, this item, is a bit difficult to answer, but the best answer here is letter C. Okay? Yeah. Let's go for number 23. Which of the following best describes the progression and features of chronic apical periodontitis or CAP leading to phoenix abscess? So these are old terms. CAP, phoenix abscess. Well, nowadays we don't really use these terms for endo. Now, these are not diagnostic terms that are used for endo. They are not part of the classification. Okay. Letter A. The acute lesion, again, CAP leading to phoenix abscess. The acute lesion resolves due to neutrophil activity with complete bone regeneration and radiopacity on X-ray. Mm. Letter B. CAP develops when irritants are removed and osteoclastic activity increases due to T cell activation. Letter C. The lesion may remain asymptomatic until disturbed, resulting in an acute flare up. Letter D. Chronic apical periodontitis is always symptomatic and shows increased bone resorption due to pro-inflammatory cytokine activity. Okay, let's look at the statements. So what if you don't know what a phoenix abscess is? Okay, that's ano, no, that's an important item, no? That's an important condition, eh. 'Di ba? Kasi this is talking about transition, no, from progression of chronic apical periodontitis, no, to phoenix abscess. Eh, what if you don't know nga what that is? But I would say that everybody here knows what a CAP is, 'di ba? No, that's the most common diagnosis you have for for EXO. No, there's no way you don't know what CAP is. No? Then again, no, as I've explained to those who discuss their endo cases with me, no, yung chronic apical abscess is the term that we use kasi for EXO. No, under it, you have your granuloma, your cyst, and your abscess, di ba? No, but in endodontics, no, we don't use this term. We use no asymptomatic apical periodontitis, no, and for abscess we use chronic apical abscess, no. For the chronic ones, we're not talking about symptomatic ones, okay? No, kasi chronic apical abscess, no, what is not symptomatic. So again, when you see in letter D, you already saw yung big warning sign, the big red flag, right? The word always, no? So you already know letter D is not the answer to this question. So eliminate. All right. No, letter A, the acute lesion resolves due to neutrophil activity with complete bone regeneration, blah, blah, blah. Okay, so this one is tricky if you don't know what a phoenix abscess is. Why? Because the thought of phoenix, when we think about phoenix, it's rebirth, no? Something dead, and it got born again. So you might be tricked into choosing letter A because of the aspect of complete bone regeneration, no? But no, at least if you know what the chronic apical periodontitis is, you know that it's not acute, right? So that's what will help you eliminate letter A. Okay? No? So, yeah, no, I'm just teaching you how to eliminate. No? Letter B. CAP develops when irritants are removed and osteoclastic activity increases due to T cell activation. Ha? No? So, irritants are removed and then it develops. It doesn't make sense. Okay? So actually, no, letter C, the lesion may remain asymptomatic until disturbed. That's your CAP. It's asymptomatic, right? No? But when it's disturbed, it results in an acute flare up. So this is what a phoenix abscess is. No? So this phoenix, this so-called phoenix, is the reactivation or the flare up. No? Kasi nga, ang phoenix is associated with flames. No? So that's why they use this term. Pero nga, ayun nga, it's a bit, it's a bit misleading kasi that's why this is not a term that you would want to use now, no? But at least you should know what this means kasi nga, you don't know what type of, if it comes out in the exam, right? Huh? So, the answer here is letter C. Okay? Did you get it? Did you follow the thought process that we were going through here? Huh? So I hope you're no, no I hope you're processing the exercise in test taking as well. No, it's not just the endo concepts. Although of course this is primarily endo, no, but uh, test taking no will really help you. Test taking skills will really help you succeed. No? If you know me, you will know that I'm very clinical. No? But here in this case, no, we're focusing on test taking because that's also your goal, not to pass the exam, diba? No? So, ayan. And your exams are coming soon, right? Kailan ba exams nyo? Di ba magti-take up exam na kayo? Do you have your schedule for take up exam? Wala pa? Uy, parang kung walang kausap ah. Do you have your schedule for take up exam? Alam ko malapit na yun.
May
Konting
15
topics na
po
lang.
yata daw.
May 15. Oh, you know. Half a month na lang. Di ba? Half a month na lang. 9 clusters. Okay, so ayan. Kaya that's why we need to that's why we need to adjust your techniques or tactics no as well, no. Anyway, sige. Wala naman ako. Think that number 24. 24. Number 24. Which of the following is true regarding periapical or radicular cyst, a sequela of chronic apical periodontitis? Yeah, so it clearly already told you that it's a sequela of chronic apical periodontitis. No. Okay. Letter A. Periapical true cyst develops as an inflammatory response without epithelial involvement. Letter B. A pocket cyst is entirely enclosed by epithelium and does not communicate with the root canal. C. A true cyst forms in three stages: proliferation of dormant cells, rest of Malassez, formation of epithelium lined cavity, and surgical enucleation is often necessary. Okay? Letter D. Radicular cysts are always asymptomatic and do not require intervention. Okay. No? So, again, you've seen always. So, letter D. Right? So, this is already eliminated. Okay? No? Even if you don't read even if you don't read the entire understand the entire statement, no, it's already eliminated because of the word always. But let's see. Are these always asymptomatic? Well, they're almost always asymptomatic. Okay? But they will require intervention. Okay? No, so that's and yeah, yung always nga is the trick here. No, in uh, eliminating this choice. Okay? Yeah. So, you know that is epithelium line. Kaya nga siya well circumscribed. Right? No? So, yan. And of course, because it is a radicular or periapical cyst, no? Which is a sequela of your CAP, then definitely it's connected no, to the root canal. Okay? So, the answer here is letter C. Okay? So that's how we, eliminated our choices. Okay, letter B. Letter B. Letter C. Letter B sinabi ko. Letter C. Next. Yan, hypoglycemic na kasi ako. Kaya, di pa nag-breakfast. Kaya yun, later kailangan natin mag-break. Okay. Anyway, number 25. Why is it clinically important to understand the interrelationship between endodontic and periodontal infections? Letter A, because periodontal disease always precedes endodontic infection. Ito na. You have this, you have this always term. Letter B, to ensure that only periodontal treatment is given for any tooth with bone loss. Hmm? Any tooth? Only? Yan. Again, these are clues. Letter C. To correctly diagnose and treat teeth with both endodontic and periodontal involvement, preventing treatment failure due to overlooked sources of infection. Well, this makes sense, right? Letter D. Because endodontic and periodontal diseases never coexist in the same tooth. And of course, this doesn't make sense. We've already, established that they can coexist. So the answer to this is yes, letter C. Okay? Again, it's easy to answer if you, especially, of course, if you know the answer, then it's easy to answer. And but additionally, it will also help you if you have the skills for test taking, because you're already removing, the noise, right? And okay, next, a crown to root ratio of 1:1 is considered a contraindication for endodontic treatment because A. It indicates good periodontal support. B. It suggests poor crown to root support, risking restoration failure. C. It means the tooth is non restorable. D. It has no impact on prognosis. Okay. So again, no, okay, okay. Ayan. No, definitely, because it already said that it's a contraindication. So, no, letter D is already eliminated as the choice. Okay? And letter A is also eliminated as a choice because it's already said that it's a contraindication. So it's something undesirable, right? Okay. So we're now left with letter B and C as our choices. Okay? But does the crown root ratio actually tell you about restorability? Not necessarily. No, not really. No. So you can restore it, but the question is, will it survive? No. So that's why this poor crown root ratio, no, uh, of 1:1, no, is already uh, contraindicated. No, so that's letter B. Okay, yan. What do we want ba na crown root ratio? The ideal crown root ratio is 1:3. The optimal ground root ratio is 2:3. No? May ideal eh. No? So, you distinguish between ideal and optimal. Na? Kasi pag K9, madali yung 1:3 sa ideal. Tama ba? But, it's very rare to get yung ideal ground root ratio. So, we go for optimal. Okay? Yan. Yung 1:1 is definitely, it's already a Hail Mary. If you try to do that, some patients will still insist, no, but uh, that's already a very poor prognosis there. Okay. Yeah. Anyway, number 27. Which of the following conditions is most likely to contraindicate endodontic therapy due to anatomical challenges? Contraindicate. So what you're looking for is something that's not good. Okay? Kasi sabi dito, which of the following conditions is most likely to contraindicate endo? So you will be looking for something that's not good for endo, no? And it's an anatomic challenge. Okay. Letter A definitely out of the choices. Why? It's normal eh. No, so it's not detrimental, it's not negative. Letter B, calcification of canals, pwede. Letter C, fully erupted healthy tooth, syempre positive to. Adequate periodontal support, it's again, it's a bit far from uh endo in terms of the treatment itself, but again, this is something that's preferred. So the only thing that's challenging actually would be letter B. Okay, that's why that's our answer. Okay, number 28. Which of the following is not a contraindication for endodontic treatment? So this means that all of the choices here, except for one, no, is a contraindication for endo. Okay? No, so again, read the question very well. So let's see. Letter A, insufficient periodontal support. Yeah, contraindication. Yeah. B, properly positioned restorable tooth. Well, this is a good thing, right? Letter C, non-restorable tooth. Yes, contraindication. Letter D, abnormal canal morphology. It might be a contraindication, no? Especially if you don't have the necessary equipment to handle abnormal canal morphology. Okay, so the best answer for this, number 28, is letter B. Okay, again, ano yan eh, it's a matter of context, no? And the best answer. Kasi nga, abnormal canal morphology is still something that can be managed orthodontically. It's just that, no, it depends on who's doing the endo and with what equipment, right? Yeah. Oops. Oops. What's wrong with my mouse? Yikes. 29. Which of the following statements best explains the consequence of a failed apical seal during obturation? Consequence of a failed apical seal during obturation. Letter A, it prevents the coronal restoration from adapting properly to the tooth structure. I don't know what that has to do with it. Okay. Letter B, it allows microorganisms to enter the pulp chamber from the oral cavity. Failed apical seal. That has nothing to do with failed apical seal. Letter C, it may permit microorganisms or irritants to escape through the apical foramen into surrounding tissues. Apical foramen. Okay. Letter D, it enhances the retention of cones within canal system. Okay. So we're talking about a cause of the consequence of failure of apical seal. So letter D is already eliminated because it's a positive thing, right? No? And letter A is eliminated because it's totally just coronal. Okay? Letter B, no? Pulp chamber, no? Again, eliminated. Now, even if you do, even if you did not understand the entire statement for letter C, now you've already eliminated the choices A, B, and D. But let's see if the statement in letter C, no, is a consequence of failed apical seal during obturation. May permit microorganisms or irritants to escape through the apical foramen into surrounding tissues. So the answer is letter C. Okay? No? So, yun. Diba? You can eliminate the choices just by understanding the question. Okay? Yeah. Number 30. Which of the following best describes the consequence of a compromised coronal seal in endodontically treated teeth? Letter A. It enhances the retention of gutta-percha filling. Letter B. It prevents the formation of smear layer on canal walls. C. It allows the ingress of oral fluids and debris leading to canal contamination. Letter D. It facilitates the setting reaction of root canal seals. Alright, for one thing, the question is what? Talking about something that's negative, diba? Consequence of compromised. When you say compromised, negative yon, no? That's something that you don't like, no? Coronal seal. So earlier we were talking about failed apical seal. This time around we're talking about compromised coronal seal. Okay? So the choices here, you will see that uh you're looking for failure. Now you're looking for negative effect. But if you look at your choices, letter A, that's something good. Letter B, that's also something good. No, letter D, it's also something good. Right? It's only letter C that's negative. Okay? So just by again understanding the question, no, you can already tell na and understanding that what whether the choices are positive or negative, No, you can already tell that letter C is the answer because it allows the ingress of oral fluids and debris, leading to canal contamination. Diba? Tama? That you understand kung how this happened, no? So again, no, your test taking skills, no, will help you, no, even if uh there are some situations, or you might encounter situations wherein you encounter concepts that are not familiar, or terms that are not familiar, because in this case, no, you if for example the choice in letter C is something that you're not very familiar with, or something that you're not 100% about, but you've already seen that A, B, and D, no, are not even matching the question because they're all positive things, no, then no, you're automatically, you will gravitate to letter C, diba? No, so that's that's something that can help you taking while you're taking the exam. Okay? Yan. And I think we can have a short break kasi maubusan na rin ako ng boses. uh, let's ano, let's resume at 10:45, 20 minutes, about 9